In this video, we will explain top 4 sexually transmitted diseases. Infection with sexual diseases occurs through direct contact between the surface of the skin and the mucous membrane of the genital organs in syphilis, condylomas, or through contaminated secretions from the genitals, as in gonorrhea, chlamydia, herpes, and AIDS. Any damage to the skin and mucous membrane greatly increases the risk of infection during sexual intercourse. A pregnant woman who is infected with some sexually transmitted diseases may transmit the infection to her fetus through the placenta, or during childbirth, and cause him to develop a serious or fatal disease. Symptoms of sexually transmitted diseases. Symptoms vary according to the type of disease. Number 1. Symptoms of gonorrhea, trichomonas, and chlamydia. The appearance of abnormal secretion from the vagina, or from the male genital organ. Burning when urinating. Number 2. Symptoms of herpes. Among the most common symptoms of herpes, blisters. Open ulcers are accompanied by severe pain. Number 3. Symptoms of condyloma. Condylomas are characterized by the appearance of small, painless verrucae warts on the skin and mucous membrane. Number 4. Symptoms of syphilis. One of the hallmarks of syphilis is the appearance of a single, circular, painless sore in the first stage, and a rash in the second stage. Most women do not have any symptoms, so the time period between exposure to the cause of the disease and diagnosis is much longer, which increases the risk of transmission and spread of the disease in the internal genital organs. Since a large percentage of people infected with STIs do not show any symptoms, it is recommended that anyone who has had sexual relations with a number of partners, especially those who have had sexual relations with a partner from one of the risk groups, seek medical advice and routine examinations to deny infection with the disease. Causes and risk factors for sexually transmitted diseases. More than 250 diseases are transmitted during sexual relations, and they result from various causes, including bacterial diseases, such as gonorrhea, chlamydia, and syphilis. Viral diseases, such as herpes, condyloma, hepatitis, and AIDS, parasites, trichomonas, and pediculosis pubis. The most important groups at risk are injecting drug users, intersex, having sex with multiple partners. The disease is diagnosed by obtaining medical advice and routine examinations to rule out infection with the disease. Among the most important examinations conducted: cultivation of the reproductive organs, a blood test to detect the presence of antibodies to the pathogen. Treatment of sexually transmitted diseases. Treatments vary according to the type of disease. For example, 1. Treatment of viral STDs. Treatment of sexually transmitted diseases from viruses is a complex process, and most likely it is not possible to fully recover from it. There are many drugs that greatly affect the disease, and the possibility of its recurrence. 2. Treatment of condylomas. Local treatment of condyloma eradication by solutions, electrical burning, freezing, or laser beam aims to prevent the spread of the disease and its transmission to the husband or wife and the fetus during childbirth. Prevention of sexually transmitted diseases. Infection with sexually transmitted diseases can be prevented by the use of insulators and various means of prevention and protection. Take care and caution in everything related to having sexual relations.